We are live and we're on Instagram. It's good morning. It's great to see you. You're mighty bright and you're wonderful yellow. I want to say good morning to all who are listening in. I'm Mark Morial. I'm President and Chief Executive Officer of the National Urban League, and we're going to have a great conversation this morning. Thank you for your time. And my co-driver, my co-collaborator, my partner in this discussion, Dr. Stanford, why don't you introduce yourself and let everybody know a little bit about you and get into a great conversation.
Yes, springtime. So my name is Dr. Ayla Stanford. I am a wife and a mother. I'm a pediatric surgeon by training, a doc for over 20 years. Most people started to learn about me for the work that I did during COVID. I'm from Philadelphia, born and raised, and I found that people of color, predominantly Black folks, both rich and poor, Black and educated with insurance, did not have access to vaccines and testing for COVID. And so I used my private pediatric surgery business to provide access to over 100,000 Philadelphians during the pandemic. And so with that, I was appointed by President Biden to be the Health and Human Services Regional Director. I wrote a book, which we could talk about a little later, and opened a multidisciplinary practice in this community with the lowest life expectancy so we can get to better health outcomes for our community. And so I'm excited to talk about where we are right now, particularly in our Black and Brown communities.
So, I want to just let everyone know Dr. Stanford is a subject matter expert. I am not. I'm a recovering lawyer and a recovering politician, but very, very tuned in to what is happening in our community. And, Dr. Stanford, as I move around, I see, it seems like COVID cases rising. And then in some discussions I have with people, they say, well, why are you even talking about that? COVID is over. It's behind us. It's a thing of the past. It's soon going to be like the dinosaurs, just something we study. Any merit to that? Tell us the truth, the whole truth, and nothing but the truth when it comes to COVID. We need to level set.
Level set, okay? When we talk about health of all conditions, the leading causes of death in the United States are heart disease, cancer, which is why the screening for colorectal, breast cancer, skin cancer is so important in our communities. But number 3 is COVID, Mark. Number 3 is coronavirus disease. So yes, we're not wearing masks, we're unmasked, we're free, we're doing whatever we want, but it is still the 3rd leading cause of death in the United States. And it does not need to be, not any longer. 4th is casualties from homicide, suicide, unintentional injuries and such. But number 3 is COVID.
So let's delve into that just a little bit more, because if we still have deaths from COVID, what does that tell us about the vaccine? Because I think it's important to understand how powerful and effective the vaccine is, but understand its limitations as well. What should people know?
Fantastic question. So the vaccines are to prevent us from getting COVID, or if we have COVID, to have a less severe experience with having it, reduce hospitalizations and reduce death. That is the purpose, not just of the COVID vaccine, but of all vaccines, are those 4 things. Now, for those of us who have had bouts of cancer and we're getting treatment with chemo and radiation, those with lupus, those steroids, or have COPD or asthma, certainly pregnant women, are very young and are very old, are at higher risk. So when you ask the question, why are people still dying? Mainly those who have multiple health conditions, are immunocompromised, meaning their immune system can't mount as strong an infection. Those are at greater risk. And also, when you're in an environment, as we used to say, the super spreader events, there's a lot of people that has it, and you're getting virus and virus and virus. Even being vaccinated, you can still get coronavirus disease. Again, a less severe form of it that may make you feel crappy a little bit and inconvenience your life because you were about to travel somewhere, but it should keep you out of the hospital and prevent your death.
So it's fair to say that deaths are significantly down, but the presence of COVID is still there. Is it advisable? I got a note from my pharmacist for people to be revaccinated, or let's say update their vaccinations. Is that advisable?
Yeah. So when we talk about the updated vaccine, it is very similar to flu vaccine. Me being
Sound people can't hear. Yeah, I am the audio.
we have to get updated flu shots are because the strain, the virus will mutate. Them great, great, the virus, same thing, will no longer protect me against this new form of the virus. And that's why the updated one is so important, especially again in pregnant folks, young folks, seniors, people with comorbid conditions, people with cancer, people with autoimmune diseases, because their immune system, even with the vaccine, is not going to be as strong.
Here's the thing. So are you saying what you're saying is uh, for preventive purposes, to be a person of optimal health, it is advisable to look at the vaccine, the flu vaccine and the COVID vaccine is something you need to do every year?
So so fantastic question, attorney Morial. Yes, come August, September is when you really start thinking about, okay, it's time, we're going into flu season. But even now, especially for folks that have those comorbid health conditions, I'm going to keep talking about it. And listen, Black and brown folks are more likely, unfortunately, we know the stats, to die from heart disease, to be diagnosed late with cancer, to have conditions that are untreated because, quite honestly, they got more pressing diseases, things going on in their life that they're attending to, like their families and supporting and such. But because of that, the updated vaccine for you is of critical importance because of the value you place in your.
Now
So,
let's talk about how you get it, right? And so I may say, hey, I can't afford it. And I heard that the free vaccines are over. Is that true? Is that if I can't afford it? So obviously, if I have insurance, insurance will pay for it. If I have Medicaid will pay for it. But and if I have insurance through one of the exchanges, then the vaccine will get paid for. But if I'm in that group of Americans, multiples of millions who have none of the above, what do I do?
so the Central introduced the Bridge program. So it is a bridge.
You say the Bridge program, and where can people learn about the Bridge program?
So you can learn about it. Vaccines.gov is one way. Certainly, if you go to our website, Black Doctors Consortium, bdcccares.com, you can learn about it. But it basically is a bridge to take care of all the folks who don't have insurance or are underinsured, even folks who are undocumented. Okay, that you can come into a location at vaccines.gov and get the literally life-saving vaccine at no cost to you.
Isn't it remarkable that in a short period of time, bioscience and biomedicine developed a vaccine? And isn't it also remarkable that this nation had the wherewithal to deploy it uh, to millions and millions and millions of people, even as we were operating in an environment of vaccine deniers and misinformation peddlers? Maybe help us understand how remarkable, because sometimes when remarkable things happen, we take them for granted. We think it's automatic. We think it's always been that way. Help us set this moment in history.
So I would look at COVID and the pandemic, the world's worst, as triumph over tragedy. In the beginning, there was there were mixed messages. People thought Black people couldn't get it. People thought it was a disease only rich people got. You had to take a cruise or travel to China. All these things that were myths that we had to debunk. And it came so quickly, the recommendations and so forth. But we learned so much from that experience that honestly, in healthcare, we should never repeat again. But to put it in perspective, as a physician scientist, and I'm a bit of a geek when it comes to that kind of stuff, it had been studied for a decade prior, and everyone thought they developed it too soon. No, but when all the research all came together because it was necessary for all of us around the world, that's how it got on shelves so quickly. So it wasn't that it didn't have the same testing and the same scrutiny that every vaccine that we have has. It just means it happened a lot faster because it was of paramount importance to save lives, all colors,
It was
all
an
socio.
emergency. When
Was
there's an emergency, every fire truck in the fire department goes to the fire, not just the fire truck in the neighborhood of the building that's caught on fire. When you have an emergency, all forces need to be deployed and have to be deployed. So I'm so glad that you said that. Now, health disparities, let's talk. So at the beginning of COVID, we called on public authorities to begin to release disaggregated information of emergency room visits by race, by gender, by age. There was some resistance. Ultimately, we got an opportunity to get a real window into the disparities on the front end. It's been my sense and impression that over the long arc, that the Black vaccination rates became equivalent to the white vaccination rates, and in some cases may have exceeded those rates. Is that a fact? Is that a verifiable fact?
so not only is it a verifiable fact, but I'm gonna take a little privilege to praise the work of our organization. Bloomberg News actually reported in October 2021 that Philadelphia had vaccinated more Black Americans than any other city in the United States. And that's because much of what we did was intentional to the communities that were impacted the most. We went to the people, we went to churches, we went to mosques, we went to street corners, we went to parks, we went every place where Black people were. We went to the public, where the folks that drive the buses, we went to SEPTA, we went to people and we did that. So that happened at the height, but we have started to see some of those numbers come down. And so, what I would say, because I want us to enjoy our lives and livelihood, if it's been a minute, if you have to think, Dad, when was the last time I got my COVID shot? Call your doc. Call your doc. Okay. If you know you're an at risk person, take that extra step. If you know you're good, but your grandma's not, or your neighbor is not, or someone from your church isn't, take them to get it because it should be at no cost to you or minimal cost with
I
insurance.
said to people all throughout COVID, when it was occurring, that taking the vaccine was not about you alone. Because COVID, and we have to keep reminding people, the highly contagious nature of COVID makes it different than dreaded diseases like cancer, makes it different than dreaded conditions like cardiovascular disease. Those are not contagious. COVID is contagious. And when I made the decision early on to take the vaccine, I was thinking about my loved ones, my friends, and the community, not about myself. And we have to instill, when it comes to COVID and flu, a sense of community responsibility and not just me, myself, and I. So I'm proud of the communities across the nation, the Black communities across the nation, who defied the predictions, and we got our vaccination rates up as high as any other community and exceeded it. That talks about this infrastructure, community-based infrastructure, this all-in effort we had. Now we have to continue that. We cannot give up. We cannot give in. And I think that is what you're saying.
Absolutely. And how about taking that moment, putting it to everything? Yes, COVID, yes, flu, but can we get our hearts checked out? You know, we do so much. If you feel a twinge, you feel something, get that checked out, right? If you're a woman over the age of 40 or less than 40 and you have a breast cancer history, when was your last mammogram? If
And
you,
look, I'm on my soapbox about lifestyle.
yeah,
I'm on my soapbox about you can control what you ingest. I'm on my soapbox and I don't care about paying attention to what you're trying to incorporate any level of fitness, even if it's walking into your routine. We all have to engage in individual, collective, family, and community steps that we take to meet modern science and modern medicine somewhere in the middle, because modern science and modern medicine alone won't do it. So I want you, before we get ready to close out here, to once again share with everyone about the resources available for people to get the COVID vaccination, and also just another time about why in this moment it is still crucial that we get the vaccine. You are the expert. I am just the amen corner and the echo chamber. You are the expert, and we all want to echo and amen what you're saying as an expert on this subject. So let's talk to the community as we close with this information that they need to take away and take down.
my take home message is we don't want to go back to where we were. We know what that was like, being sheltered in our homes, being unable, having loved ones in the hospital that we could not visit. And honestly, I just want to take a minute and pause for the lives lost.
Mm.
Did not have to be lost to COVID. With what we know now, there's no reason why we shouldn't use every tool in our armamentarium. And vaccines, I have had at least 5 of them. And I'm here and I'm grateful to what I feel. No longer is it we don't have access, we don't have the resources. You can go to vaccines.gov and get it. You could Google Dr. Ayla Stanford. I believe I'm the only one in the United States with that name.
Spell that last name so they don't get it.
University, Stanford, Stanford, Ayla, ALA. You can certainly reach out to me and to our health center, BDC Cares, blackdoctorscares.com, and we will direct you wherever. The resources are here. We will help you advocate for yourself and for your family. And again, if you're good, think about what Mr. Morial already said. It's your neighbor. It's that person in church. It's someone you still hear coughing. That's something else you don't want is long COVID. Folks had COVID 3 years ago. They're still coughing. Their lungs aren't great. It's tough for them to walk because they get short of breath. That can all be prevented. And statistically, Black Americans are more likely to get long COVID than not. So we know what we need to do. This is just a reminder.
Yeah, and as we close, I want to lift up the National Urban League's All In campaign, which began in 2020, run by our health equity team. The All In campaign touched literally millions of people through our network of affiliates with accurate information about COVID, with information about the vaccine, and then we stood up vaccination sites in almost 40 communities across the nation. The All In campaign, and we continue to promote uh, the necessity and the propriety and the benefits of people getting all vaccines available, flu, COVID, certainly like. So it's the All In campaign. And I want to thank Urban League affiliates across across the nation, Urban League staff here in New York and in all of our communities for the success of the All In campaign. And you can always Google the National Urban League at NUL.org to follow the important work that we're doing all across the nation. It's been great to be with you today. I really appreciate your work. Long live the great city of brotherly love and sisterly affection. Philadelphia has a special place in my heart. I'm a UPenn grad, so I spent 4 glorious years in Philadelphia. Love your hometown. Appreciate your wisdom and insight today. And I want to thank everyone for joining us on this IG Live. All right. Is that it? We done?
Yes, sir.
Hold on. Hold on. It says live.